Splinting upper extremity fractures. Splinting upper extremity fractures involves the use of various techniques and materials to immobilize the injured upper extremities, such as shoulder, arm, forearm, wrist, and hand to prevent further damage. Here are common upper extremity fractures and how to splint each one. For shoulder fractures, use a sling to immobilize the arm and shoulder, securing it around the neck for support and stability. To splint an arm fracture, use a padded board or a sturdy stick that extends from the shoulder to the elbow, securing it with cloth or bandages above and below the fracture. Forearm fractures. To stabilize the elbow to the wrist, use a strong, flat object like a board and secure it with bandages. And the last one, hand fractures. Place a padded board along the palm and back of the hand. Use bandages to keep it in place. Leave the fingertips exposed for circulation checks and seek medical attention immediately.
Splinting lower extremity fractures. Splinting lower extremity fractures requires careful consideration due to the potential for severe internal bleeding, pelvis, hip, and femur. These fractures often completely immobilize the person. Due to the risk of life-threatening internal bleeding, evacuation is usually recommended. If splinting and transport are necessary, the splint should extend from lower back down past the knee of the injured leg. Knee. Splints extending from the hip to the ankle are used for knee injuries. These splints are applied to the back of the leg and buttock, ankle, and foot. These injuries can be wrapped using a figure-of-8 pattern. Additional support can be added along the back and sides of the ankle to prevent excessive movement. The foot should be kept at a right angle in the split to immobilize the ankle. Toe. Body tapping the injured toe to an adjacent healthy toe can provide temporary support until professional medical evaluation. Types of splints. Various types of splints are available, each designed for specific fracture types and situations. Box splints. These pre-made splints form a box-like structure to immobilize the limb. They are commonly used for upper and lower limb fractures where the limb can be straightened. Vacuum splints. These moldable splints become rigid when air is removed. They are ideal for fractures where the limb cannot be straightened. Traction splint. Designed to maintain traction and realign fractures, especially femur fractures. Fracture straps. Made from plastic or nylon, these straps can immobilize limbs and the pelvis. Triangular bandages. Versatile for slings or holding dresses in place, they can also be used for immobilization. Importance of splinting. Splinting fractures is essential for several reasons. Pain reduction. Immobilizing the fractured area significantly reduces pain by preventing movement and muscle spasms. Reduce risk of further injury. Splinting prevents further damage to bone and surrounding tissues, allowing for proper healing. Improved healing. Proper immobilization promotes bone healing by keeping the broken fragments aligned and reducing movement. Safe transport. Splinting allows for safe transportation of the injured person to medical facility without exacerbating the injury.